Recovery as a service provider. I'm a nurse and I've been a nurse for 30 years. And I suppose I've seen lots of changes within our services over that time, and especially within the mental health services. So I suppose recovery means being honest, okay, as a practitioner, and not being a fixer. Okay, as a practitioner, we can very much have that opinion that we need to fix everybody. So we don't need to be fixers. It also, I suppose, means that, you know, we see people who can leave our service, you know, live a good quality of life. And for me, I suppose, as a service provider, it also means I can be honest about how I am, you know, how I feel sometimes, you know, about my own experiences in life, without having to, I suppose, always be perfect or always be clinically well as such. So that's been quite a good experience working in that recovery focused manner. I suppose ARI for me has brought, I suppose, a framework around how I practice in a recovery focused manner. It's also brought into focus the value of the lived experience, working in a very real and partnership manner. ARI has, I suppose, looked at, you know, and allowed us to reflect on practices within the service. It has allowed us to look at the challenges within the service and work towards, I suppose, a partnership with the person with the lived experience, with the family member, in around improving the service and making it a better service for not only for the service using the family member, but also for the staff who work within the service. So better outcomes for everybody. For mental health services to become more recovery focused towards recovery, I guess recovery has to be embedded within the service. You know, it can't be an add-on. You know, okay, I'm an advancing recovery coordinator. There's also recovery leads within the Carlow Kilkenny service, but everybody has to buy into it. You know, it has to come from the top down. There has to be good leadership around recovery. The person with the lived experience has to be involved at every level of the service. Has to be involved with everything that we do. The promotion of recovery focused education that's co-produced by the professional and the person with the lived experience and the family member needs to be encouraged, it needs to be funded, and it needs to be valued. And I think that would also, you know, that would help sort of mental health services improve on their recovery outcomes. I suppose looking at mental health services, I suppose I would see personally looking at them, I see mental health services need to look more towards maybe primary care, you know, and the value of the recovery education piece with the lived experience in that primary care before they even come into our services. But yeah, funding, resources, education, you know, we need to concentrate on, you know, all disciplines, you know, and their training and their education, you know, before they come in, you know, before they even start working in the services. So you're talking about training in a very much a recovery focused manner, you know, at university levels. We need the lived experience involved in curricula change and curricula development in universities and colleges, and that would be a key to that, I suppose, recovery focused practice.